Welcome, everybody, to Live with Dr. Carolyn Dean. Carolyn is amazing. She's a doctor, she's a naturopath, she's an herbalist, she's an acupuncturist. She's going to tell you exactly what she would do if she were in your shoes. I can't think of a person who has devoted more time to helping people's health than Dr. Carolyn Dean. She can make a huge difference as you listen to her words of wisdom. We know she's ahead of time because she is the doctor of the future. Welcome, Dr. Carolyn Dean. Yay, Carolyn!
Yay, Jenny. Here we are again.
Making our own bliss, which we do on a regular basis, right?
Oh, yeah. Yeah, it's amazing what our products, our formulas are doing for people. Anyway, yeah, we'll get to it. I'm very excited about everything that's happening for us.
Yeah.
And for the people that we serve.
Yes, absolutely. Well, I brought up the bliss part because Rachel, our producer, just typed to me in the chat line, by the way, I'm totally blissed out now that I'm sipping my formulas through the day, because I think Rachel was kind of a chugger, but she's learned how to be a sipper.
Yeah. Because everybody's carrying around their water bottles. So why not put your minerals in your water bottle? You can keep it in a bigger bottle and then put a few teaspoons in of your formula. I make up a big 32-ounce mason jar, and I think it lasts maybe 11 days, where I'm putting in a few ounces of the Remag, few ounces of Remite, few ounces of Pico Silver, Pico Potassium, zinc, copper, and sometimes Recalcia. So it's all in this water, 32 ounces of water. And then I'll put in my vitamin C reset berry powder for the flavor. So that's my formula for the day. And then I'll put it off into my drinking bottle. What do you call it? Water bottle for my morning walk. I don't carry it. I mean, I carry my 3-pound weight. And so I'll drink that after the walk and after the pool. And then through the day, I'll get to the rest of the formulas. So yeah, you just sort of, I guess that's like a bit of a hack to make it easier on you, so that every morning you don't, I have to put a teaspoon of this. You make the formula up in bulk. Do you do that, Jenny?
No, I do not have a bulk master formula. And you're saying it lasts 11 days. So you're saying you dole out a little bit and it sits on your counter and it remains stable and fresh throughout that time, because we have so many people say, can I make my minerals up ahead of time? And the answer is, of course, right? Yeah. Absolutely.
Yeah, because you just do the math. If I'm doing 2 teaspoons a day of Remag, 2 of Remite, 2 of Pico Silver, 2 of Pico Potassium, and 1 of the zinc copper, that's 9 teaspoons. So that's 3 tablespoons. So, when it's all mixed up, when you get the formula right, then you every morning you're just putting 3 tablespoons in your drinking water for the day.
Very cool. Okay, so 3 tablespoons of your bulk formula that you've mixed in all of its combination. And do you keep it on the counter or do you refrigerate it?
I just keep it on the counter, because these minerals, I mean, they're totally stable. I'm just are there 2 teaspoons in a tablespoon?
3.
Okay. Yeah. And how many tablespoons in an ounce?
that's where I go sideways.
Yeah.
I know there's 16 tablespoons in a cup. No, in a pound. I don't know, because I just had to look that up this weekend. I was making an apple pie.
Okay, so how many tablespoons in an ounce? Why aren't they telling me? Yeah, 2. Okay, so I was a bit backwards, but yeah, I do.
Right, they were 16.
I
Okay.
do 3 tablespoons. So maybe I'm taking extra, and that's why I'm so healthy.
Well, that probably is. I'm going to tell a little story on my brother who had an interesting episode, and he's got a little bit of toxicity in his body. He found out through some blood testing. And he's only been taking the daily, health maintenance dose of the products, but he hasn't been feeling great. And I'm like, well, when you get a cold, you automatically take more zinc, more D, more C. So when you start not feeling well, you've got to, ratchet it up. So I think maybe taking too much is working in your advantage and probably protecting you in ways you don't even know. Everybody can take too much.
Yeah, yeah. That's where the I don't know, subconscious or just the white light of whatever comes down on people, and you do something out of character, but it turns out for the good.
That's right.
That's
That's
pretty,
right.
yeah.
And for those of us who are just joining us live on Facebook, X, or YouTube and have no clue what we're talking about, welcome. This is the inimitable Dr. Carolyn Dean, and she is the formulator and the brainchild behind RNAreset.com, which is her mineral formula. But tonight we usually do a health opinion show. She's got a lot of different things she's going to talk to you about. Her blog, she's going to talk to you about hacks, she's going to talk to you about news and all the things that are happening in media today where people are talking about health solutions and pushing pharma solutions that may not be optimal for you. She's been at it for 55 years and highly credentialed. So we welcome you to kick back and join us and take it all in and ask questions on the chat line if you'd like to. And interact with all of our visitors tonight who are here to learn about you and to learn from Dr. Dean. So take it away, Carolyn.
Very good. Library, we're back to magnesium, the missing link to total health. That's probably backwards or upside down, but this is my book from, when did we publish this? Was it this year or last year, Jenny?
June of 2024.
Woo. And what I did was put what I learned in the past 30 years in this one book, just to condense it. And it comes across better than the 600-page tome of the Magnesium Miracle that I was writing for Random House since 1999. But this book is awesome. When you look at the index, you see that we have the magnesium deficiency health conditions that go through, kidney stones, insomnia, dementia, depression, cholesterol, all things that can be magnesium deficiency. So that's the book we're taking the blogs from, in a sense. And this week it's I guess the title, maybe Ginny, you could correct me, there really is only one magnesium to take. Is that what we ended up with?
That is exactly what it's called. And it's so very true.
And it's like Ginny and I have this life task of how to describe our magnesium as being the one and the only and the most important magnesium. And it's because it's a stabilized ion of magnesium. Now, what Julie and I we talk about on our morning walk is, well, do people understand what an ion of magnesium means? So then in this blog, I'm trying to differentiate between the magnesium compounds that people are constantly being advertised about, whereas our magnesium is the element of magnesium in a picometer size, and as a stabilized ion, which is highly reactive, jumps into the cells, does its job, and it doesn't have to act like a compound. A compound, which is two parts, a magnesium part and then a chloride or a oxide or citrate or glycinate part. And a compound, it has to be broken down in the bloodstream. It's called dissociation, where a compound will just sort of fall into its own separate ions. And in that little tiny instant, that's when that magnesium as an ion can be absorbed into the cells. So it's like Russian roulette. You don't know when you'll get your magnesium or how much you'll get. But what the chemist that works with us has done is stabilized our ion of magnesium. It stays in the bottle stable as a magnesium ion for years, and we've proved that in the laboratory studies. So what we're sort of up against is this new marketing scheme where the magnesium companies are saying, well, we have 12 different magnesium compounds and we can do so much for you. And they'll talk about how, well, you know, the magnesium taurate, the taurine is going to help your heart, and on and on and on. A lot of words. The oxide is going to help you with constipation, and the sulfate as Epsom salt, you put that in your bath for muscle soreness. Or the big advertising push is threonate, magnesium L-threonate, for anxiety and cognitive function. But it's like they're trying to market the whole compound, especially the non-magnesium part. But what people are looking for is magnesium. So it's partly the amount as well. I wrote this in the Magnesium Miracle 2017 edition, the 600-page tome. In 500 milligrams of a magnesium compound, you've got magnesium oxide. In the 500 milligrams, 300 milligrams are magnesium. And that sounds awesome. Wow, a lot of magnesium. Let's take that. It is a surefire laxative. So people aren't able to take very much before they get the laxative effect. Magnesium carbonate, 150 milligrams out of the 500. That's laxative. So is magnesium hydroxide. Then you get magnesium citrate. There's only 75 milligrams in 500 milligrams of the compound. 75. Malate, 75. Magnesium chloride, 60. Glycinate, 50 milligrams. Sulfate, 50. Taurate, 50. Magnesium L-threonate, 34 milligrams in 500 milligram compound. Now, I've told the story many times. When I first got involved with writing the Magnesium Miracle, that's when I realized I was very magnesium deficient. And when I went out to get magnesium that was more than the 50 milligrams in my multiple, I got the laxative effect. So and finally, when I got my Remag product formula, I was able to take 1,200 milligrams straight magnesium and no laxative effect, because it doesn't cause a laxative effect if the cells really need it. You take it through the day, etc. Magnesium L-threonate, if I had to take that to get 1,200 milligrams, I would be trying to swallow 18 pills, and they would be laxative. Magnesium ortate, 30 milligrams in 500. Magnesium gluconate, 25 milligrams in 500. So hopefully that makes some sense, that you don't want to think that a magnesium compound is equivalent to the magnesium that the body's really looking for, because I want people to take 600 milligrams of magnesium a day. And again, if you're looking at the gluconate, 25 milligrams, to get 600 milligrams, you would need 24 pills. So magnesium, when bound to other substances, becomes an inactive magnesium complex. In order to get into the biochemistry of your cells as a magnesium ion, it must be converted back into free magnesium ions before your body can use it. So the only form of magnesium your biological system can use is active magnesium ions, not a compound, and certainly not 10 or 12 different compounds. I think that's a lot of work for the body. So that's why I developed a stabilized ion of magnesium. In its active form, it gets into the cells. And it even works on constipation in the sense that it makes your intestinal muscles work in a peristaltic function as the body needs it to work. You don't take a magnesium to flush through the bowels as diarrhea. So I think I've made my point. What do you think, Jenny? Have I made my point?
I believe so. And I love you reading off the list, because anybody at home or who's watching this in the future who's switch hitting, and maybe they think they should take Remag in the morning and magnesium glycinate at night because it helps them sleep better, will understand fundamentally now that they've been misled. Mm-hmm. And it's all marketing. It's all hype. And it's not clinical. It's not appropriate for the body. And it causes unnecessary expenditures. And we just had a great conversation with the practitioner who was making a similar recommendation. Take one kind in the morning, one kind at night, 2 different magnesiums a day, and bada boom, bada bing. Oh, look at all that. What else was happening is they were wasting a lot of their clients' money on things that Remag is it. I mean, it's the one, it's the only one, and it's the one you marry. You don't have to do any more dating. No more on the app looking for somebody.
Yeah.
Remag, and you stick with it. Absolutely.
Perfect. Okay, we did get some questions in, so
yes, we did.
I'll go to them and then come back to you to see if anyone's putting questions on the board.
Perfect.
So someone is saying, I'd love to try the vitamin C powder. This is our vitamin C berry powder, which I will order, but I don't want to overdose. I need your opinion on how I would recommend to take it. And I guess basically I have been talking about taking extra ascorbic acid, vitamin C. This person is also saying it has potassium in it. And we do put potassium in our vitamin C berry powdered to neutralize the acidity, but to also allow potassium to work with our magnesium because they have similar functions. But why I'm promoting higher dose of vitamin C, even beyond the fact that the berry powder is a flavor masker for the strong mineral taste of our minerals. So it's serving that function. But our vitamin C berry powder, a scoop is 2,000 milligrams. Now, Linus Pauling, who we go to for all we want to know about ascorbic acid, vitamin C, he says that humans we don't make our own vitamin C like most of the animal kingdom. If you compare an animal who makes their vitamin C to humans, we might need about 10,000 milligrams. And, people just don't understand what's going on there, but it's information that Linus Pauling wrote about 50 years ago and was kind of sidelined, ignored. I mean, who wants to, in the big pharma, who wants people to think that they can work on their heart disease and their infections and and their diabetes and their blood sugar with vitamin C, they'd rather give you drugs. So you won't overdose on vitamin C berry powder, even if you take 5 scoops a day or more, because it's water soluble and it leaves the body. It doesn't build up. And like I said, the potassium is the buffer for the ascorbic acid acidity. And I think that answers that question. She's also saying, I was avoiding salt and then I started introducing mineral salt again. Hopefully she means sea salt. She says, I feel better now overall with your products and the sodium. And then she says, I'm nervous I may be hardening my arteries with so many minerals. Should I be concerned? And when you look up minerals that harden in the body, it's calcium. When you get someone splattering water all over the bathroom sink, as happens in one of my sinks, that's calcium deposits. So why calcium will build up is because you don't have enough magnesium in your body. So calcification is magnesium deficiency. So our minerals won't build up, and we don't recommend our Recalcia all that much, except for people who don't eat any calcium-rich foods. So if you're not eating dairy and you feel kind of achy, you may need our Recalcia. And I only recommend about 600 milligrams of calcium in your diet, plus supplements, 600 milligrams. And I also say you should take 600 milligrams of our Remag and balancing everything out like that. Another question, I think same person. I feel that my hormones may be off. I fear getting heart issues. My last mammogram showed small calcium deposits. I'm 70 and I'm determined to find answers. So hormones, most menopause symptoms are cleared with our formulas, especially our Remag and our Realign B complex. And I would add in the omega-3s and the vitamin D3, K2. Personally, I use a small amount of bioidentical triestrogen and progesterone as a vaginal cream. And I started that back, when I was in my mid 40s, because I had a pretty sudden stress induced living in Manhattan menopause. And for heart issues, calcification is the main concern in heart disease. And magnesium is the answer there, and vitamin C. So vitamin C is making collagen to keep the arteries from developing little tears that lead to cholesterol putting a Band-Aid on the tear to try to let it heal. But if you don't take vitamin C to heal the arteries by making more collagen, the cholesterol will stay there. And if you're magnesium deficient, there'll be relatively more calcium in your bloodstream. The calcium will gravitate toward that cholesterol, and that's an atherosclerotic plaque. And then she says about her mammograms, small calcium deposits. That's the calcification of magnesium deficiency. And that started to get called DCIS, disseminated something introductional I think carcinoma. They tried to call it a pre-cancer, scared the daylights out of so many women, led to all kinds of squishing mammograms, which now they're worried that mammograms can be causing symptoms in the future. So Remag, 2 teaspoons a day is what I would be taking throughout the day. Another question. I stopped eating fast foods 39 years ago. No pop, candy bars, dairy as much as possible. So this is the same person. So what's she doing? She's calcifying by eating maybe too much dairy, because dairy calcium is very well absorbed. So as I say, as much dairy as possible may be the cause of the calcification. 600 milligrams total is enough. but it must be accompanied by 600 milligrams of magnesium. And then I guess this is a couple of testimonials. I love all your products. I use them daily. They are the highest quality supplements and highly absorbable. Dr. Dean is amazing. She's the queen of magnesium. I highly recommend. Another, I can't say enough about this company and all of their products. I love all RNA Reset products and have been a loyal customer since 2018. This magnesium bomb is the best. I use it to supplement my daily magnesium and it works great. I take the Remag picometer size liquid magnesium as well. And I use the bomb to supplement. This allows me to get all the magnesium I need while bypassing my gut. Highly recommended. I'm so glad there is an electrolyte product like this with the spectrum of minerals. With my condition, I use BioElite trace mineral concentrate and even Pedialyte. And in building back up my mineral content in the body, this one helped the best for longer hydration, balance, and getting my body back to feeling normal. We'll continue to buy. Now that's awesome, the way people will give us the testimonials about their comparison of products. Now, Ginny, if you don't have any questions, I'm going to dive right into why our RNA reset is the best, as these testimonials are testifying to. So do you have any questions?
I do have two quick questions. And of course, it would make sense that Alejandro would ask if Remag is going on sale anytime soon. So we'll come back to that question, Alejandro. And also a quick question from Erlene. Can you take Remag with iron pills?
Yeah, there would be no reason why not. They're not antagonistic, but be careful about iron pills. They're constipating, very little absorption. Call customer service, and I think we have an FAQ on a liquid iron solution that's much better absorbed.
We do. Okay, that's it. Let's proceed.
Okay, now we're going to pros and cons of supplements, drugs, and research. So that title covers a lot of what I want to say here about RNA Reset being branded on the website sup.co. I think we've mentioned it in passing, supp.co. So they're a company, they're a platform that's already evaluated 800 supplement brands and 160,000 products using its proprietary trust score system. It's a 10-point scale based on 29 quality attributes like third-party testing, manufacturing standards, transparency, and innovation. The RNA Reset brand trust score is 9.29 out of 10. We're rated as excellent. And we haven't even finished putting in all our certifications for the 29 qualities. 9.29. So we're in the 98th percentile, which means we rank higher than 98% of all brands in their database. And Grok gives me these words. It says, this positions RNA Reset firmly among the elite tier of trusted brands, likely in the top 10 to 20 overall, based on the database size and score distribution, where scores above 9 are rare. So that's very cool. So I started looking at different companies, and they had dozens, even hundreds of different supplements. So that's one thing that I think places us in a position where we're trying to help people with a handful. We have 14 products. Mostly people are taking 6 or 8. And we're not asking you to look at 100 different products and choose which ones. We have decided, we mean me, with my 55 years of experience, I know what our cells need. We're no different on the cellular level. So I can say, well, your cells need these, and we have them in just our basic formulas. Most of the supplements on the market these days are treating the symptoms of magnesium deficiency and yeast overgrowth. So we focus on those problems so that people don't have magnesium deficiency or yeast overgrowth. And then the multiple mineral deficiencies, that really affects the thyroid. So we can help people's thyroid by working with our multiple mineral. Now, so yeah, I'm saying these companies are not concentrating on therapeutics. They're selling supplements as if they were widgets. So we should be in an extra special category for trying to complete a person's nutrition with our perfect formulas and not just selling 100 different pills. So I started to think about, well, what's the rating on other magnesiums? Our Remag is 9.29. So I asked Rock for a rating on Slow Mag. It's a big brand. I've known about it forever. Turns out Purdue makes it. They're the pharma company that gave us the opioid scandal. So they make Slow Mag, and their rating is 3.75 out of 10. So it's rated as poor. And they're a huge seller. So yeah, we're going to lobby Subco to make non-essential ingredients and products part of their assessment. Now, maybe they're already doing this because Slow Mag says on their label it's preservative-free and sugar-free, but it's not chemical-free. Here are the ingredients. Well, first of all, it's Slow Mag. What do you think? Well, it's a magnesium formula, but no, it's got first ingredient calcium, 238 milligrams, magnesium, 143 milligrams. So they're back in the bucket of, oh, you have to have 2 parts calcium to 1 part magnesium. It's not true. It's 1 to 1. And the list of ingredients, it seriously made my stomach turn. So they've got the magnesium chloride, calcium carbonate, which is chalk, methyl acrylate acid copolymer, polyvinyl pyrrolidone, tricetin, microcrystalline cellulose hypromellose, titanium dioxide, maltodextrin, acacia, magnesium stearate, stearic acid, mineral oil, carnauba, or something like carnauba wax, cross carmelose, sodium lauryl sulfate, FD&C blue number 2 lake dye, pharmaceutical glaze, propylene glycol, and talc. Now, what I realized later is it's a drug company, and if you look at drug ingredients, you see a lot of this stuff going on. I think they say it's enteric coated, so they have to have the wax and the copolymer and something else. I mean, I started looking up all these different ingredients, and it was just too disgusting. But that's in a vitamin supplement, and this is where the vitamin industry is moving toward. Big Pharma wants to take it over and say, well, we can police the supplements better because we are Big Pharma, but they're going to put in all this other stuff. I don't know, maybe they have contracts with these companies that make all these different chemicals. Anyway, what do you think of that, Ginny? We're up against slow mag at 3.75.
Well, I'm so excited now that customers have a reference and they can even share it with their friends and they don't have to take our word for it. And I was just at lunch with my girlfriend the other day, and she was telling me, now she takes Remag and Remite, but she was telling me for her vitamin that she takes some thing. I can't even remember what it was called, but it was so great. I just get out my Supco app, type in the name of the thing, and no heavy metal testing. And its score was like 4. And I just showed it to her and I said, no heavy metal testing? And she freaked out. She's like, oh my God, I've been taking this every day for 3 years. And I was like, yeah. And she said, well, how do I get rid of the heavy metals? And I said, well, Remag. So, it's funny when people can come face to face with the money that they're wasting on this stuff. And this is the purpose of the app. And we just want everybody to get on Supco, get your own account, start looking at it, and start sharing the information with your friends. It's going to make a huge difference. And everybody who wants to feel better wants to feel better. So they need to get what is the best.
Yeah. Awesome. Very good. Any questions before I continue on?
Yes. Are we closed with this topic?
Yes. I mean, I'd love to go on. I'd love to sit here and go over every magnesium.
That's right.
Yeah.
All right. Alejandro asked, now Alejandro was the one who asked about the sale. So let me go back and say, yes, we will have a sale on Remag. Our semi-annual sale, it begins in November on the 7th, I believe Friday the 7th, and goes over the weekend. So you'll have a chance to get a discount on all the formulas site-wide that weekend. Look for your email. Make sure that you go to RNA Reset and put in your email for our newsletter. And then that way you can get notified right away. But I think it starts November 7th, somewhere around in there. The next thing that Alejandro asked is, what is the best way to help heal the thyroid?
Well, for hypothyroidism, definitely a multiple mineral, which has 9 of the 12 minerals, support thyroid hormone production. So there's that. But if the thyroid has been attacked and put into thyroiditis, an autoimmune condition, you have to look at yeast overgrowth. And for that, we work with a natural antifungal and a picometer silver. So we approach it from both angles. Hyperthyroidism, I try not to touch, because if a thyroid is in a state where it's producing large amounts of hormones for whatever reasons, then it can stimulate heart palpitations, etc. So that needs to be treated medically. But I do talk about it in one of the thyroid books, and you could ask customer service for a cut and paste of that information.
Very good. Very good. And also, Remite is the name of the multi-mineral solution. And so that is, you find that at rnareset.com. And then we also want to, Alejandro, Diana Orlando's asking about Supco, and the link is up here on the chat. Diana, just scroll back and you'll find it. Melody Rose posted it. Okay, I think we're caught up. I think we've got everything we need.
So under the same designation, talking about drugs and supplements and all that. So I came across Dr. Robert Lustig, and he's our pediatric endocrinologist who came down hard on high fructose corn syrup, and has a great video. It's got millions of views, called The Bitter Truth. And so he's been out on YouTube a lot lately. I think he must have a new book. And he says after age 60, Your metabolism changes, your absorption changes, your stomach acid drops, even your mitochondria change. Enzymes don't work as well. And so it's like, oh my gosh, it's like you feel the crush of what he's saying. He says flooding with mega vitamins even stresses these processes. As you get older, you have fragile blood vessels and your skin is bruising. So as we get older, if we have, so, he goes on and on, just, bad news bear. And so I'm saying that as we get older, if we've used up our stores of nutrients, if we don't replace them, then we'll get these symptoms. If our blood vessels are fragile, it's because we haven't been taking enough vitamin C. If our stomach acid drops, we haven't been taking enough magnesium to help that chemical process that makes stomach acid. Absorption changes, well, then you can kind of circumvent that by taking minerals that don't need help with absorption, but you can also heal your intestines because most of the irritation, I think, in the intestines is from yeast overgrowth. So all these things that they're talking about, where he and every other doctor, when you go in, as soon as you hit 60, they say, oh, well, it's just aging. Even mitochondrial changes. Mitochondria work better if you exercise. So get your exercise. They work way better if you take your magnesium. So take your Remag. And, what I'm saying is with our formulas, there's no interference with poor digestion or poor absorption. And when you get our formulas, you start healing up your digestion and your absorption. So yeah, aging is a time when you need to take supplements that are better absorbed, and that's what we aim to do for any age. So Ginny, anything to add to that?
No, I think you said everything perfectly there.
I said everything perfectly.
Everything perfect.
Okay, then look at this. We're going on to our articles.
Okay.
We hardly ever get to them. So the first one, Rachel, is it's in this gray zone. A study calls for tighter oversight of IV hydration spas. So this is coming to me because I'm writing a book on vitamin C right now, and I want people to be able to get IV vitamin C if they're in a horrible state. But then I also want them to take oral vitamin C to prevent getting in a bad state. And we are putting together a high dose ascorbic acid with lysine and proline formula so that you'll have it in the right proportions. And the lysine and proline are what will keep the buildup of LP little a. It's the latest cholesterol subgroup that's supposed to be the bad one, and apparently it's related to the fact that we don't have enough vitamin C, and lip LPA tries to take the place of vitamin C, but then ends up causing blood clots on arteries and causing the atherosclerosis. Too much detail for what I'm trying to say here, but we want people to have access to intravenous vitamin C. And what's happening is the hydration spas are surging in popularity, but only 4 states have policies, just safety policies, etc. And so these hydration spas, they have to get together and adopt standards for registering their facilities, along with the potential benefits and risks. So as I say, I'm hopeful that the IV vitamin C and magnesium drips will become commonplace and start to fulfill the needs of the public and escalate to treat very serious conditions. Of course, they'll be very expensive, should be covered by insurance. But for IV magnesium, actually, our oral magnesium can do just as well. And better in a sense, because when you take an IV magnesium push, you get a high amount and then it drops, and you have to get it done every 2 or 3 days. With our Remag, which is fully absorbed, you're taking it throughout the day, every day. So you don't have these ups and downs. And as for the vitamin C, you can take a couple of scoops of our vitamin C berry powder. 2 scoops will give you 4,000 milligrams of vitamin C, and that you will start seeing how it can help on so many levels. People, as we get older, we should not have bruising on our arms. That indicates lack of collagen and, weakening of the skin. If the skin is bruising, then internally there is weakness as well. Okay. Anything from you, Jenny? Any questions or comments on the board?
Yeah, Diana Orlando's asking about something that you spoke about in passing earlier, which is about mammograms and the frequency of getting them and that kind of thing. And if you could comment on that.
Yeah, it's difficult. What should have happened by now is women should have been offered thermograms, and that's taking the tiny 0.0 or maybe 0.1 degree temperature change can indicate something that's rapidly growing. So thermogram can diagnose something that's coming, long before it's felt, long before it's palpable. So I don't know. I would just try to find a thermography clinic, someone who's doing it, find out their rating, find out if their success with preventing or diagnosing cancer early so that it can be prevented. Mammograms, I don't know what to say about them. I've never had one. I know with the magnesium deficiency and the calcification in soft tissues, they're finding more and more breast tissue calcifications and trying to call it precancer. So we have information about mammograms that maybe they're not so beneficial, but they're so ingrained that women are kind of being forced to do them. I really don't have a good opinion about whether or not you should do them or not. I would just like to promote thermography. I know it's kind of a weaselly answer, but I really don't know what else to say.
I don't think it's weaselly. I think it's very direct. You've never had one. You're not interested in having your breasts irradiated. I had one in the 80s and quit. I thought the whole procedure was very violent. And that's before I met you or knew anything about this. I just thought it was absurd. And I remember in 2013, when we were hanging out in San Diego, you had a friend who was traveling that does thermography and was very effective at it. And there's a great thermography center here in Charlotte. So I think it's totally appropriate. And aren't thermography scans read by radiologists or no?
Yes. I mean, they're well trained in it. Yeah.
Yeah.
The thermograms, they're sent off to some. It's not like someone in the back room just looks at them. No, they're sent off and properly read.
Yeah. Very good. Excellent. So yeah, I think that was a great answer. Thank you very much.
Okay. So the next article, Rachel, is Parkinson's risk may rise with restless leg syndrome. Yeah. So what does that make you think of when you hear restless legs? Magnesium deficiency is possible and, even likely. So are they just diagnosing magnesium deficiency and giving it different names?
Right.
Yeah. So Yeah, they're saying Parkinson's risk appears to be higher in people with restless legs syndrome. A drug they used, a dopamine agonist treatment, was found to lessen the Parkinson's risk in patients with restless leg syndrome. Of course, they're just looking for an early diagnosis so they can start prescribing drugs. Big pharma is big business. And of course, I'd be looking at our picometer magnesium as a treatment of restless legs. Who knows how many Parkinson's conditions we've prevented by people taking our magnesium for their restless legs. And Parkinson's, they still don't know what really causes it. What comes first. It's a whole chicken and egg, because there's this protein that they think is associated, and why does it form? And there's aluminum toxicity, there's this and that. But when you look at what magnesium and a few other nutrients can do, vitamin C, of course, that can be very beneficial for keeping the brain healthy. We talk about the 2 million mitochondria in each of the 86 billion brain neurons. And the mitochondria, they house the Krebs cycle. So I don't know how many, I'll have to see if I can find that number. In each mitochondria, how many Krebs cycles are functioning at any one time. And the mitochondria Krebs cycle are making the ATP energy, and that requires magnesium. So if magnesium is not helping make brain energy, does it allow more heavy metals to get into the area? Who knows? Vitamin C for sure is an antioxidant. And if you have too much sugar, blood sugar, it defeats the vitamin C from getting onto insulin as a transporter, and you're just transporting a whole lot of sugar into brain cells and not allowing enough vitamin C to get into brain cells to be the antioxidant. So there, magnesium and vitamin C for restless legs and preserving your brain. The next article, supplements in children, motivated parents and scarce data. Now, scarce data, I mean, whose fault is that?
Yeah.
First of all.
Yeah.
What our problem is, as a dietary supplement company, we're not even allowed to say that our formulas can be used by children. The most we can do is tell parents to look at the RDA for different vitamins and minerals, and then just use the RDA of our formulas. The liquids and the powders are easy to give in the quantity that matches the RDA for children. But there's this kind of a scare tactic here about, oh yeah, herbs and supplements are being used to treat pediatric patients, making it essential that providers ask about supplement use. So they want the doctors to say, are you using supplements? And then tell them to stop, because doctors don't know enough about vitamins and minerals to be able to give an opinion. So doctors don't have any idea how to discuss supplements with patients, never taught about them in medical school, and for the most part think they are unnecessary. So they'll just say, oh, don't bother, eat a good diet. Where's the kids living on Pop-Tarts and hot dogs? So the article comments about this multi-billion-dollar supplement industry, and they say that more than half of American adults and more than a third of American children are taking at least one type of dietary supplement in a 2023 review. The article went on to say, be sure to ask about dietary supplements at every healthcare visit, and make sure that you are documenting it so that we can track if there are any side effects. So do they track drug side effects so diligently? And as for side effects, I mean, there are so few people. I mean, someone may choke to death, heaven forbid, on a dietary supplement, but there's rare side effects with dietary supplements, except this is where SUPCO comes in, because they will get to the bottom of the certification to not have heavy metals, to not have drugs. We are NSF certified, which means we have a sports certification, which means all our products go through special testing to make sure there are no added drugs. And this is where sports nutrients and weight loss nutrients come under scrutiny, because they will stick in some drugs to make their supplements work better, and people won't be aware of it unless they have a sports certification. And of course, they talk about the limitation of federal legislative oversight and the Dietary Supplement Health and Education Act of 1994 that exempted dietary supplements from pre-market review, allowing products to enter the market without efficacy testing. Now, they don't test the efficacy of drugs either. They allow drugs to come on the market that they compare one drug to another and say, oh, this drug works better. And then, oh, okay, go ahead and use your drugs. That will definitely cause side effects. So SUPCO has come at the exact right time. And the FDA does monitor. We cannot make any health claims. We cannot put testimonials on our websites. The FDA, they say, does not require any manufacturing standards. But it does. I mean, they have visited us. And a 2019 study of adverse events from supplements in youth, the article says it identified 977 adverse event reports that included 166 hospitalizations, 39 life-threatening events, and 22 deaths. Now, I didn't look into what they were talking about there, but that could be overdosing on something or other. So they are monitoring, but they're not putting up, like I've enumerated in Death by Modern Medicine, the 1 million excess deaths that occur due to drugs, surgical procedures. I have a whole list of things that I collected from government databases of allopathic and big pharma death. And as I said earlier, the highest risk supplements were those marketed for weight loss, muscle building, and energy. For energy, you just need Remake. And yes, again, kudos to sup.co for their diligence. It's awesome what they're doing. I don't know. I think I just have a couple more articles. I'm going to press on. Ginny, do you have any questions?
We are all good and caught up right now.
Awesome. Gabapentin use keeps rising, especially among older adults. And why is this? Because doctors keep prescribing it. Gabapentin. I mean, I've talked about it's what is it? Neuroptin or something. Ginny, can you look up the neuro name for gabapentin? It's probably in my notes, but I forget it. It's the 5th most dispensed medication nationwide, despite growing safety concerns for older adults, according to new federal data. For perspective, there are over 24,000 prescription and over-the-counter drugs in use. So gabapentin, it's Neurontin.
It is Neurontin. Yep.
So gabapentin Neurontin prescriptions increased from about 24 million in 2010 to 59 million in 2024. 24 million to 59 million. And the number of patients receiving the drug increased from 5.7 million to over 15.5 million. So it was approved by the FDA for partial seizures, post-herpetic neuralgia, restless leg syndrome, there's restless legs, It's widely prescribed off-label to treat other forms of chronic pain and to calm excited neurons. Read into between the lines, magnesium deficiency. Patients aged 65 years or older were prescribed gabapentin more than twice the rate of younger adults. Many clinicians still view gabapentin as benign and underestimate the number of falls that occur when you're on this type of neurological sedative type drug, and the risk of delirium. And they say electronic health record systems do not provide good safety prompts. So what does that mean? In this statement, it really bothered me because it implies that doctors don't know enough about drug side effects and safety risks and drug interactions and depend on electronic health records to provide them with safety prompts. It's like, oh, excuse me, doctor, you're giving a drug to someone that has this condition and this drug, and it's going to have a bad interaction. It just boggles me. So I asked Grok if these safety prompts warned of drug interactions. They said yes. They said drug interactions, drug allergy contraindications, and dosing errors or inappropriate medications. So studies show these prompts reduced, by identifying them, they reduced injury by up to 50 to 70%. So I think the higher prescription rates probably are due to thinking it's a safe drug, the desire to finalize a short patient visit with a prescription. And this article says doctors are trying to stay away from opioids. The side effects of gabapentin can include neurocognitive decline, delirium, motor disturbances, in gait instability and falls. A decline in kidney function due to age can result in the drug's accumulation and toxicity. And they say alternative therapies with more favorable safety profile should be considered when possible, but no mention of magnesium and potassium and B vitamins as the alternatives, and that will never happen. Let me see if this is my last article here. Yep. So let's finish off with this last article, Rachel, on blood pressure. Blanket blood pressure target disserves older adults. They're really going out for older adults. The older generation will take any pill that the doctor prescribes. So, when you're visiting your elderly parent or aunt, look in the medicine cupboard. And anyway, maybe not. This is a commentary. So, but I'm saying, just like with statins, big pharma and big medicine is lowering the acceptable level of cholesterol to give more statins and sell more drugs. They're doing the same with blood pressure. In recent weeks, the American Heart Association and the American College of Cardiology updated their joint guidelines on managing high blood pressure for the first time since 2017. The new recommendations define normal blood pressure as 120/80. So if you're 125/85, you're high blood pressure. So these new guidelines are causing more harm than good for older adults. And they say they're focusing on dementia, where hypertension is seen as a modifiable risk factor for both causing microvascular insults and for heart disease. The association between hypertension and Alzheimer's is less clear. Okay, so they're trying to take high blood pressure of any elevation as sort of irritating the brain and popping little blood vessels in the brain. So, well, we got to keep that blood pressure down. and they're trying to say that there are no negative consequences associated with lowering blood pressure. But I was taught that the elderly had more rigid blood vessels. That's the calcification, with risk of hypotension, low blood pressure. Your blood pressure goes low, you get dizzy, you fall. Electrolyte abnormalities and acute kidney injury. And older blood vessels needed a higher blood pressure to get blood to the brain. So these guidelines are saying the opposite. There was a comment that calcium channel blockers may have some neuroprotective effects, but what's the natural calcium channel blocker? It's magnesium. So they conclude that, unfortunately, blood pressure management in the geriatric population cannot be managed with a one-size-fits-all approach. So they probably did some study. I wasn't at this conference, etc. But they probably did some studies and said, oh, if we lower the blood pressure too much, people are just fainting all over the place and causing more problems. So yeah, they'll as long as medicine avoids looking at nutrients as being helpful for blood pressure, for calcification, for the collagen that you need to keep your blood vessels healthy, they are just going to play these clownish games, giving people drugs, doing a study, and doing the oops, that didn't work, and then going and looking for a different drug rather than looking at nutrients. It's a calamity, folks. But luckily, you're here with us, and you don't have to put up with calamity anymore.
Correct. No more calamity.
Mm-hmm.
Now, I just want to say Judy Kennedy is asking about how to measure out her water and her minerals and that kind of thing. And those are definitely things that you can get information from customer service on.
Mm-hmm.
And Rachel, if you can go back to the gabapentin slide real quick and let our viewer here find out where the article source is so that she can go back and reference it. It's Medscape. Is that it, Carolyn?
Yeah, most of my stuff comes from Medscape, but they reference the studies, and then you can look up the study by name on PubMed. PubMed.com.
Okay, very good. Thanks, everybody, for joining us tonight. I just want to say that if you are missing out on any of the information or just have a hankering to hear Dr. Dean speak during the week, you would want to go to her website, drcarolyndean.com. This is where we house all of her archives and all of her important information, including all of her books. Her most recent, Exposing Sugar Toxicity, talking about that. And she's got a couple new books that are going to be out before the end of the year that we're really excited about. You are interested in the formulas by now, for sure. RNA Reset is the place you want to go to get your hands on those. And we will, again, be having our semi-annual sale coming up here in a couple weeks. So stay on track for that. And then during this holiday season, we want to emphasize the fact that you are able to send a gift order to friends and family this holiday season. And there is nothing more important than the gift of health. And giving the gift of health for your family members makes all the difference in the world. And every time I can do it, I'm always going to do it. And that's the same with Pico Pets. And those are our friends who have our furry animal friends in their family. They need to be healthy too. PicoPets.com. Please check us out there. And again, encouraging you to go to SUPCO. Dr. Dean's talked about it many times tonight, SUPP.co. Download it on your phone through the Android or iPhone and start using it and interacting with it. It's just fabulous. So thank you, everybody, for all of the great comments and sharing and personal stories that you've told tonight on the chat line. We appreciate all your engagement. Share the podcast and invite a friend next time. We'd love to have them here with us. And here's our hearts. That's right. These hearts are for Alma and everybody. Elma always sends us hearts all the time. Thank you, everybody.
You have been listening to Dr. Carolyn Dean, the doctor of the future. Become a member of drcarolyndean.com and get access to all her leading edge of creation information, as well as archives, webinars, and other valuable media resources. Join Dr. Dean and Ginny Almighty same time again next week.